Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah rabbil alamin. Assalatu wassalamu ala rasulillahi ajma'in. Amma ba'd. First of all, our gratitude goes to Allah, the one and the only one God who has given us so many favor and graces. And we give praise and greeting to Prophet Muhammad sallallahu alaihi wasallam. The Honorable Dr. Wisma Yunita M.Pd as a lecturer of English course in Bengkulu University, and all the audience whom I respect. My name is Rizki Okta Dila. I am a medical student of Bengkulu University. On this occasion, I will present one of research article journal that I have prepared before. The title is Uterus Preservation After Placenta Percreta and Uterine Rupture, a Case Report by Yurong Zhao. This article contained in the journal Medical Case Studies, volume 10, number 1, page 1 to 4. And this is the journal citation link. This is the table of contents. The first is introduction, the second aims and method, the third is case report, and then discussion result, and the last one is conclusion. We start from introduction. Adherent placenta disorders are potentially fatal for pregnant women. This review focuses on placenta percreta, which is more severe than the other condition. This paper describes the case of a woman with an intact uterus after a history of 2 instances of placenta percreta and 3 instances of uterine rupture. And then aims and method. The red one is aims and the blue one is method. The aims are contribute to the knowledge of the early diagnosis of placenta percreta and highlight the advantages of uterus preservation, including psychological reasons and the ability to bear children in the future, and synthesize available diagnostic and treatment methods for placenta percreta. And the method describe a case of 40-year-old multigravida with a history of 2 instances of placenta percreta and 3 instances of uterine rupture, previous artificial abortion, and uterine carriage. And the patient uterus had been preserved after undergoing an emergency uterus repair operation and scheduled cesarean within 5 years. And then case report. The first hospitalization, the patient was a 35-year-old woman. She was initially admitted to the hospital because she required labor induction in September 2008. Her last menstruation period was in March 2008. And the second hospitalization, the patient was 39 years old and she was admitted to the hospital a second time because of infertility in December 2011. And the third hospitalization, the patient was 40 years old and she was admitted to the hospital a third time in July 2013 because of her pregnancy with her second child. Her last menstrual period was in November 2012. And this is the discussion result. Morbidly adherent placentation, or MAP, is a serious complication of pregnancy. Placenta percreta will have significant effect. Uterine rupture in pregnancy is rare and it can often be life-threatening and catastrophic. And traditionally, placenta percreta is treated by removing the uterus. The key to conservative treatment is effective hemostasis, and prenatal diagnosis and identification of an abnormal placentation are essential for several reasons. And the last one is conclusion. Patients with placenta percreta may not have any symptom, and placenta percreta may not affect intrauterine fetal development. However, if it is found during delivery, it is more difficult to manage, especially in cases of natural childbirth. Therefore, an early diagnosis is particularly important. Additionally, an early diagnosis of uterine rupture can save a patient. An adequate prenatal assessment, accurate diagnosis, and timely treatment are essential to reduce maternal and child mortality and complication. That's all I can say on this occasion. Thank you for your attention. And if there is a wrong word or pronunciation, I apologize. To Allah, I beg your forgiveness. I hope my presentation is useful for all of us, and hopefully we can meet again in next time and in another time. The last, stay safe and stay healthy. Assalamualaikum warahmatullahi wabarakatuh.